Music, I'm 84 years old and I have no cavities. My gums have stopped bleeding and my voice has cleared up. I got a compliment from the dentist. I did a great job of taking care of my lower teeth. Does this make sense to me? It was hard to believe. But what's more surprising is that they had only one thing in common. It's saltwater fall. It's not an expensive medicine or a special treatment, but a cold of mouth problems with salt in the kitchen for only a few $101. Did you know that there are so many people who have even changed the rain? Hello, I'm Jong, an otolaryngologist, who has been doing medical treatment for 42 years in Gangdong-gu, Seoul. In today's video, based on the cases of patients, I actually met and many elderly people who still practice it every day. I'll summarize into 6 key practices that saltwater gargle is not just a folk remedy, but a scientifically convincing health habit. Before we start talking, I hope you share your wisdom with us by subscribing, liking, and notification settings. The first is why saltwater gargle is so effective. Salt gargle is a health habit that is so common that it is easy to pass. However, I have seen countless cases where one simple habit completely changes the quality of life. The 76-year-old Yu was a frequent visitor to the hospital every year for a sore throat and sore throat. He got a little better after taking the medicine and kept repeating that he would relapse. Then one day, suddenly he said, "Senior, should I live on medicine? Like this forever?" To answer that question, I recommended a brine solution. Put half a teaspoon of salt in a glass of warm water and do it only twice a day. It only takes once in the morning before going to bed. At first, the old man with his head tilted came over a week later with a smile. This time, he thought his throat would hurt, but he just passed by. I feel completely different because I have a sore throat in the morning. The old man rarely came to the hospital for the next 3 years. It may seem insignificant, but these changes are by no means rare. The effects of saltwater fall are scientifically supported. When salt water is maintained at a concentration of 0.9% and 9%, which are similar to our body's fluids, it reduces swelling on the mucous membrane and cleanses off inflammatory substances through osmosis. In fact, experts advise that saltwater is effective in relieving early symptoms of colds and human inflammation. Is being repeatedly introduced in Health Chosen and Clothing Portal Hydak. The strength of this habit affects not only the throat, but also the oral health as a whole. Millions of bacteria are active in the mouth every day. The acidic environment is controlled when you eat sweet food or brush your teeth, and cavities grow actively. However, salt water neutralizes acidity, creating an environment in which tooth decay is difficult to occur. In fact, many studies have shown that neutralizing the pH in the oral cavity is the key to preventing tooth decay even in the Global Chihuahua Journal. In addition, salt water makes immune cells favorable conditions for activity, protects the mucous membranes of the mouth, stimulates saliva secretion, and inhibits bacterial proliferation. This is especially important for the elderly. Because the amount of saliva secreted decreases with age, the mouth tends to dry out, making them more vulnerable to bacteria. People who constantly gargle salt water say this: "In the morning, my mouth feels refreshed. I feel like I'm coming to catch a cold, but I don't. I go home less than before." Whenever those words are heard in the doctor's office, I think that it is a habit that is more important than medicine or procedures. However, it doesn't mean that any salt can be used arbitrarily. Dissolve it in a cup of water, which is about half a teaspoon of salt, in warm water to use. If it is too salty, it rather stimulates the mucous membrane, drying the mouth, and if it is too bland, the effect decreases. Especially in the morning, it helps to remove the amygdala bacteria that have proliferated in the mouth while sleeping, and it can suppress the reproduction of bacteria due to the decrease in the secretion of night needles before going to sleep. Recently, fall using physiological saline is highly recommended. It is recommended for those who are busy because it is convenient and hygienic at the same time as the 0.9% concentration. However, it is important to use physiological saline, a generic drug sold at pharmacies, not products that contain preservatives sold in the market. The mouth is the gateway to our body. It is also the first path for viruses and germs to pass through. The one habit is to wash the mouth twice a day with warm salt water. The immune system section is healthy. Furthermore, it protects the vitality of the entire daily life. It is only a few times, a few seconds, but the result can prevent hundreds of thousands of won in medical expenses. Many patients have personally demonstrated that their daily habits are stronger than diseases. Now it's your turn. The second is about how bacteria in your mouth are not just about your mouth, but also about your whole health. When you stress the importance of hygiene in your mouth to your patients in the hospital, you often hear this reaction. How can you even get a big illness if you say that half of your mouth is a little messy? I understand a cavity or a gum disease, but when you say that it is connected to your whole health, you usually tilt your head. However, in my decades of treatment, I have seen firsthand that bacteria in your mouth can affect your heart and brain. Nam Sangdo, 69, was a person who constantly visited the hospital. He was always worried about bad breath and complained of pain, saying that his gums were bleeding. He also brushed his teeth sincerely, but he always said that his mouth was unkunk. Then one day, he was taken to the emergency room due to a sudden cardiac infarction. The operation was fortunately completed well, but Nam, who came back to the office afterwards, said this. The doctor said. He said that his blood vessels were damaged. Because of the high level of inflammation, it could be because of his mouth. That made me feel heavy. In fact, bacteria in the mouth do not stop at just making cavities. Numerous studies have already demonstrated that bacteria in the gums can spread throughout the body through blood vessels, cause inflammation, and can lead to cardiovascular disease or cerebrovascular disorders. In particular, the cause of periodontal inflammation, called zygomatic bacteria, has been found in the brains of dementia. Patients and studies have also been published that show that when the bacteria move into the body, they cause an inflammatory reaction and damage nerve cells. Health Shipbuilding and HIDAC have also repeatedly introduced this content, emphasizing the medical community's position that mouth health is the starting point of whole body health. Therefore, you should not overlook the bad breath night mop. The symptoms are not just a problem with the mouth, but also a signal of inflammation that is spreading quietly somewhere in the body. Bacteria in the mouth actually damage vascular endothelial cells, cause inflammation, and in severe cases, can even lead to accelerated endocrinology and myocardial infarction. In this respect, oral hygiene is not just a matter of cleanliness. It can be said that it is the first line of defense to protect immunity and circulatory health throughout our body. This defense line becomes more important as we age. This is because the saliva secretion decreases, the mucous membrane in the mouth becomes thinner, and they become more susceptible to bacteria as we age, especially during the time when the secretion of dementia almost stops overnight. The inside of the mouth tends to become a hotbed for bacteria. That's why I always emphasize it. The most important time of the day is right after waking up in the morning and before going to bed. You can greatly reduce the bacterial burden by just doing saltwater fall at these two moments. Fall also lowers the acidity in your mouth. Germs grow best in acidic environments. However, warm globules make the mouth close to neutral and greatly help suppress the growth of bacteria. In addition, it reduces swelling and stabilizes the mucous membranes in the areas that cause inflammation. When I saw it in the clinic, not a few patients reported that even the saltwater fall alone twice a day reduced gum, bleeding, alleviated bad breath, and reduced symptoms of throat cold or rhinitis. Some of them were over 80 years old, and many of them visited fewer hospitals themselves. Someone told me the story. Isn't it any medicine? How does it go that far? I answered like this. Medicine helps to reduce symptoms, and saltwater. Gargling helps to prevent the cause. Expensive oral cleansers are overflowing these days. However, many of them contain alcohol or open activators, which can stimulate the oral mucous membranes if used for a long time. On the other hand, saltwater is natural and is a safe method that anyone can use without side effects. In particular, if you use salt or sea salt to dilute it in warm water and angle it, it becomes a health routine that can be practiced continuously without incurring any cost. The mouth is a window that reflects our health. That small mouth environment is the starting point for protecting our brain, heart, and immune system. If the saltwater gargle prevents disease tomorrow at once, it is by no means trivial to eat warm water in your mouth at this moment. Third, if you use the saltwater gargle incorrectly, it can be rather ineffective or harmful. It is well known that saltwater guy is good for you, but unfortunately, there are a number of people who come across it at the doctor's office. Say, I do it every day, but it doesn't work. When you look at those people, most of them are wearing the gargle in the wrong way. This was also the case with 63-year-old Jong Hyun-ja. This person was doing the salt gargling every day by searching for information on the internet, because his gums are weak and his bad breath is bad. Still, did you say that cavities still occur and bad breath still does not improve? When I asked in detail, I put a spoon of thick salt in cold water and rinse it 2 or 3 times a day. It's salty to eat this year, so I just spit it out quickly. As soon as I heard about it, my head nodded automatically. It was a typical case that something good would not work. If done wrong, and could be counterproductive, the most common mistake is to incorrectly control the concentration and temperature of salt water. If you eat too salty, the mucous membranes can be stimulated, making your mouth drier, and the mucous membranes in your mouth can be damaged. The elderly, in particular, are more sensitive to these stimuli because the salivary gland function is poor. On the other hand, if you burn it too lightly, it does not sterilize enough, so even if you gargle, the bactericidal effect decreases. The most appropriate concentration is about half a teaspoon of salt in a glass of lukewarm water. You should avoid too hot water or cold water and lukewarm water close to your body. Temperature is the most ideal. Another common error is to rinse your mouth only and finish. The true effect of saltwater fall occurs when it reaches the nail. If you just spit it out after cringe a few times in your mouth, it's just a cleaning of your mouth, and the bacteria in your throat remain intact. When you gargle, make sure to tilt your head back slightly and hold it for at least 30 seconds to let the salt water touch the nail. Many patients say that this method is awkward at first, but once you get used to it, you will noticeably decrease the symptoms of throat cold or sore throat. It is also important to take care of yourself after fall. Jong also said that she drank cold water or coffee as soon as she felt autumn. However, it is ideal to drink nothing for at least 30 minutes after fall. This is because the mucous membranes in your mouth should be given time to recover and maintain a well-stained condition. Some people brush their teeth with another type of salt water. You should not do that. A saltwater gar is effective in inhibiting germs and neutralizing acidity, but it does not remove food debris or grease. Therefore, it is ideal to brush your teeth after eating and add the gargle afterwards. In the past, 68-year-old Park Chanyong was worried about frequent cavities even after drinking more than 3 cups of coffee a day. He was sincere in brushing his teeth, but he liked sweet foods and tend to increase his half-acidness. He suggested a gargle with very little salt water and baking soda. 30 minutes later, do you have to do that at first? You did, but you were surprised that 2 months later, the dental examination found no cavities. Your mouth is less sticky and you will feel a lingering sensation. Even after drinking coffee, it feels different. Like this, saltwater gargle can be a preventive treatment if used well, but it can be useless if the method is wrong. To give you another tip, for those who are starting autumn for the first time, it is recommended to start just once a day. If you try to do it too, often from the beginning, you become lazy and tend to give up. It is important to start with a natural routine like that, once before going to bed and once in the morning after about a week. Lastly, you should also pay attention to the salt you are using. If possible, sea salt or Himalayan pink salt is better without additives. Economic salt is also okay, but if you have a lot of iodine or other additives, it may irritate your mouth, so it is good to be careful. Salt gargle is definitely a good habit. However, if you practice it the wrong way, you will be disappointed without stimulating your mouth or producing the expected effect. If you decide to do the gargle, it is more important than anything else to practice it consistently and correctly in the right way. If you build up even one small habit correctly, the result will definitely be proved by your body. First in 5 to 10 years. The fourth is about how much the effect varies, depending on how much you do during the day. There are cases where people who have been using the saltwater gargle for a long time say that it seems to be working or not. When that happens, I always check this first. Do you gargle during the day? No matter how good your habits are, the results can vary greatly depending on when you do it. Among them, timing is particularly important for saltwater fall. What I have realized over the decades is that 2 hours of morning and night are the prime time of autumn. It's not just a matter of cleanliness. To fall with salt water as soon as you wake up. While we sleep, we become defenseless. The secretion of saliva during the main body almost stops, making the mouth dry and the best environment for bacteria to grow. It is known that the number of bacteria in your mouth is the highest right after you wake up. And if you eat water or food right away, you will even swallow germs. One time, Lee Kyung-wook in his 70s visited me and said, "I drank a glass of warm water every morning to be healthy, and it could be rather bad." So I explained to you, it's good to drink warm water, but first, wash the milk bacteria in your mouth with salt water in autumn, and then drink water. In this case, he said, You have to gargle first every morning, and a few months later, your stomach is less bloated and you catch fewer colds. I used to suffer every change of seasons. Like this, morning and fall are the first act to wake up the immune system in a day. They help protect the throat, clean the mouth environment, and even protect gastrointestinal health. In fact, the association of morning gargle with intestinal health is drawing attention as studies have been published that show that oral bacteria can also affect intestinal microorganisms. And another important timing is before we go to bed. We usually just brush our teeth at the end of the day. However, right after that, the saliva secretion decreases sharply, and the mouth stays dry overnight. This means that it will be a very suitable environment for bacteria to multiply. Therefore, pre-bedding has the effect of cleaning the entire night, when bacteria in your mouth will multiply. What's important here is the order. Many people ask, do I brush my teeth first? Do I gargle first? The answer is fall after brushing my teeth. The ideal order is to remove large debris by brushing, then suppress bacteria with saltwater fall and calm down the mucous membranes. The external lugagal is also very effective timing, especially after going to crowded places, hospitals, or public transportation. It is important to wash away germs from your mouth as much as washing your hands. In fact, the mouth and nose membranes are the most important channels through which viruses can penetrate, so it is recommended to clean them up in autumn before bacteria from outside settle down. Park Sun-young, 58, works at a department store, and she came to the hospital, saying that she continues to cough even after COVID-19. Cold medicine also had little effect on anti-epidemic stamine. What I suggested was simple. As soon as you get home after work, wash your hands and rinse your mouth first with salt water. Park was full of smiles on the day. She came back home after practicing for only 2 weeks. Curiously, the long-term acupuncture has stopped. Now, when I get off work, I don't drink water first and start with autumn. Like this, I have seen many cases where just practicing fall at certain times in my daily life reduces symptoms such as colds, phosphorus, human diseases, and bad breath. The effect completely changes depending on when you gargle it during the day. If you gargle as soon as you wake up in the morning, you can wash off the lactobacillus that has multiplied overnight without swallowing it, which starts a much fresher day. It is also an important moment when you come back from the outside, cleaning your mouth before the bacteria settled in. Your body can help reduce colds and infectious diseases. Gargling, which is done about 30 minutes after a meal, is effective in suppressing the activity of tooth decay by neutralizing the acidified oral environment through food. And the last fall before going to sleep plays an important role in preventing bacteria from growing during the time when saliva secretion decreases overnight. If you practice the timing according to the situation 4 times a day, you can manage both the health of your mouth and the immunity of your whole body with just one saltwater angle. If you feel that there has not been much change even though you are doing the gargling every day, please reflect on when you are doing it first. The same behavior will work completely differently if done at the right time. I believe that habit is not only about the behavior itself, but also about the moment it enters your life. I hope that saltwater gargling is not just a health tip, but also a small consciousness that changes your day. The 5th is a special effect when the ginger, baking, soda, and propolis of the animal are combined. There are many people who have sufficient effects of saltwater fall alone to protect the health of nails and mouth. But sometimes, some people wonder why it doesn't work that well. In this case, I suggest changing your gargle habit slightly to suit your symptoms. This is because if you add a little bit of certain ingredients of salt water, the effect may be much doubled. First of all, ginger saltwater gag is recommended for those who often have a sore throat or toothache. Jong Mi Jong, 67, used to come to the hospital, often due to frequent coughs and neck pain. Her voice disappears in winter. It is also hard to answer the phone. It made me feel that I avoid even talking to my grandchildren. The vicious cycle that my throat becomes sore again, and my cough begins repeatedly even after a while with medicine. At that time, I recommended ginger saltwater gargle. Try just a drop of ginger juice from salt water. Too much of it can be stimulating. Ginger contains powerful anti-inflammatory substances that are effective in relieving swelling and relieving pain in the capillary tube. Jong said, "This time, I thought my throat would hurt, but I just passed it. There was less wheezing." My grandmother's voice became prettier. Listening to that, I felt warm on one side of my heart. It was not just that I regained my voice, but that I regained communication and laughter between people. Medicine is important, but sometimes it can be such a simple habit to protect such precious things. Second, I would like to recommend a combination of baking soda for people who often have cavities or are prone to acidity in their mouths. Jin, 70, used to do toothbrushing, but he liked sweet food and coffee so much that he used to get cavities every 6 months. He said, "At this age, wouldn't it be fun to eat something sweet? But going to the dentist every time is also..." I suggested this to Kim Jin-woo. After 19-30 minutes, add a tiny amount of baking soda in salted water with the tip of a knife to cut it. To neutralize tooth decay is the key. You like acidity. Jin laughed at first. "If it gets better, I will quit drinking coffee." But 6 months later, for the first time at the dentist, he was surprised to hear that I didn't have any cavities. It's amazing. My mouth is less sticky and I feel refreshed for a long time. On that day, Jin said, "Doctor, this is a great tip for saving hospital expenses." It is true. If you can prevent 6 months of dental treatment due to fall in 30 seconds twice a day, there is no reason not to do it. The third is the propolis combination for those who often feel a cold or have weak immune systems. Lee, 72, was a person who felt a cold coming from season to season, and her voice was always throat and rest. The problem was that she came too late every time she came to the hospital. She seems to be okay after taking her medicine, but she comes again the next week. She often missed the early stages of a cold and developed into a severe disease. So this time, I told her to put a drop of propolis in salt water to make autumn, when she feels a little bit of a cold. Propolis is an antibacterial substance made by bees to sterilize their own hives, and has recently attracted attention, to the extent that it is included in various immune-boosting products. Lee said that the cold does not get deeper than it sounds strange. This time, even if my throat is itchy, it just passes by. I didn't cough and didn't take cold medicine, and she left me these words at the end. "Abby, my body is now salt water." I laughed at that, but I also felt the sincerity in those words. I am confident that I can now manage my body by myself, because I have seen countless times how precious that sense is. Of course, the basics of all these combinations are brine autumn. Salt water is enough, but if you add 1 drop at a time, depending on your symptoms, the effect can be much greater. However, one thing to remember is to use only a small amount. Too much can irritate you, so it's a good idea to start with a very small amount at first. Thoughts go well with those who have a small cough or often have a sore throat. Baking soda is effective for those who enjoy sugary foods or coffee. And for those who often feel like they have a cold, it might be a good option to angle them with a little bit of propolis. It's not just about reducing the amount of ingredients that fit you, like a customized prescription for your body, depending on your condition of the day, creating a body that doesn't require coming to the hospital. That was the role of a doctor I've cherished the most for over 40 years. I believe these combiners could also be one of those little streets. The sixth is important information. You must know when using physiological saline instead of salt water. It's a well-known fact now that saltwater gargles are good. However, there are many people who say that it's more cumbersome than you think to burn salt, heat water, and adjust the consistency every time. In that case, there is an alternative that I always recommend. It's fall using physiological saline. Physiological saline can be used to rinse the mouth like salt water. There is one thing you need to know here. Physiological saline can be easily purchased anywhere, but not all products are the same. The same was true of Davida, who recently came to the doctor's office. She told me to get an angle, so I tried it with physiological saline, but it stings more. From what I heard, you were using a large capacity product on the internet. It turned out that it was a medical physiological saline, and it contained preservatives. As such, there are 2 types of physiological saline in the market. One is physiological saline, a medicine that can only be purchased at pharmacies. And the other is physiological saline, a medical product that can be easily purchased at supermarkets or on the internet. The physiological saline sold in pharmacies is sterilized and does not contain preservatives, so it is safe to use directly on the human body, such as the throat and the eye. On the other hand, products sold on the internet or at supermarkets often contain preservatives. This is used indirectly, such as cleaning lenses or rinsing medical equipment, and it is not recommended to use it directly in the mouth. If you gargle with it, the mucous membrane can be stimulated, and there is a risk of allergic reactions. So, one thing you have to remember, when you use physiological saline, you must choose a product marked with medicine at the pharmacy. There is another important point. Pharmacy-bought saline solution does not have preservatives, so you shouldn't leave it for long after opening it. I always explain this. You have to use it within 2 days when you open the lid. After that, germs can enter the air, so you shouldn't use it anymore. It's actually uncomfortable to pour water into a cup and drink it again 2 days later. Like that, if you open the lid, it can get contaminated over time. So you have to use it within 2 days after opening and throw it away without regret. That's why I recommend small packages for people who live alone. Pharmacies now also have good 20-long saline solution. It's small in size and portable, and it's much more hygienic because you can throw it away right after using it. There is no inconvenience of throwing it away after using it. For each treatment, once in the morning and once before going to bed is enough. However, don't finish after washing it. It is recommended that you keep your head slightly wet and keep it for more than 30 seconds until it reaches deep into your neck. And after fall, if you refrain from drinking water or beverages, for 20 to 30 minutes, the effect lasts longer. In fact, some people ask, do I have to pay attention to that much if I give you this explanation? At that time, I always say this. This door is the door where germs come in and out dozens of times a day. Imagine that you wipe the door with warm water once a day. That's the shortcut to going to the hospital. Above all, you have to be able to practice it every day. It should not be difficult and burdensome. In that sense, saline solution physiological saline can be a good stepping stone to settle in saltwater for daily life. The important thing is how to buy and use it. Don't buy anything online and make sure to choose a product with a medicine label at the pharmacy. It is better to clean up the opened saline solution after 2 days and use it if there is a small package product. If you have enough angle to your neck twice a day, reduce bacteria in your mouth, prevent a cold, and control your mouth odor, and build up your habit every day. You will definitely feel that your body is better than medicine. How did you hear what I have said so far? In a way, the word saltwater, which was so familiar that I had never taken seriously, may have sounded so ordinary at first. I have been seeing patients for more than 40 years and feel it. The first sign that the body sends is that it always starts to be quiet. I have seen countless cases where a brief sore throat, frequent dry mouth, or slight bleeding from the gums led to major illness. On the contrary, I have watched a lot of times a day when a habit changes a person's life when it seemed like nothing. Is there a face that comes to mind while watching this video? Please share this video with them. Your parents, who are suffering a lot when they have a cold, a friend who cannot avoid dental treatment, a child who has rhinitis and a night installation. One small practice can be an opportunity to change their body and mind. And I would like to say something I often tell you in the doctor's office to the end of today's video. Good medicine can lead to illness, but good habits make life healthy. Someone gives you medicine, but a habit is something I keep. I really hope that this video will be warm. Wisdom to save your body and protect someone's daily life. Thank you.